So good evening, everybody, or good afternoon. So you're all very welcome to this, the penultimate or second last session of our conference. And today has been going exceedingly well, so thank you to everyone who has presented and who has contributed. So this final session is a little bit different, as you may have gathered from the 5 beautiful people sitting up on their chairs there. And we are going to hold a panel session. So sitting with us, we have, I'll begin at the far end with Simon. And Simon lives at Botton Village Community, which is part of the Camp Hill Village Trust in the United Kingdom. And Simon works as a paid Life of Opportunity reviewer. And this aims to help improve support for people living in CVT communities. So Simon has been very active in our Cupid project, and he has previously delivered a webinar with Kate, who is sitting beside him, and he delivered a webinar on why it matters, the case for cancer screening and prevention, and that webinar is up on our website for anyone who wants to see it on our YouTube channel. So then, beside Simon, we have Kate, and Kate needs no introductions because this is probably her second time having her bio read, but Kate has been such an active member of the Action. She is the co-lead of one of our working groups, and she has already presented today also on 2 different sessions, so I really do want to thank Kate. And beside Kate, we also have Professor Peter Knapp. And Peter is a professor of inclusive health at the University of York in the United Kingdom. And Peter is also an expert by experience. He has a son who has an intellectual disability. And Peter's main research activity concerns patient use of healthcare, especially information for patients. So his work encompasses communication of harm and benefits of treatment, information to support informed consent, health literacy and numeracy, inequalities in access and use of information, and influences on patient decisions. Peter is a highly experienced academic. He's co-authored 180 peer-reviewed papers. He's generated 14,000 citations and has an H index of 62 and has supervised more than 20 doctoral students. So delighted to have Peter with us today on the panel. So alongside Peter, we have Katarzyna. And Katarzyna was presented yesterday and did a wonderful keynote speech for us in session 1. And Katarzyna is a parent of a person with a disability. She's also an educator, a co-founder, and a principal of an educational centre for children with special educational needs in Gdansk. She is vice president of the Polish Association for Persons with Intellectual Disability in Gdansk. She's a member of the European Patients Advocacy Group and a number of other international networks also. So thanks very much, Katarzyna, for coming back to present. And finally, I'm delighted to welcome Professor Aysegul Isler. And Aysegul is a professor in the Department of Pediatric Nursing at Akdeniz University, Turkey. Her research focuses on pediatric nursing, particularly the support and disease management of children with epilepsy, cerebral palsy, and intellectual disabilities and their family. And her work also encompasses pediatric oncology, complementary therapies such as reflexology and acupuncture. And Aysegul also has a sister who has an intellectual disability. So what's wonderful is we have people on the panel who have such a range of lived experiences. So the way the panel session is going to work is we have a number of questions for each panel member. But ye in the audience don't get away lightly, because we also have questions that we expect ye to answer. So what will happen is Margaret and Laura are going to look after this, and they have QR codes. So these QR codes will give you access to a Padlet system where you will be able to answer questions. Or we will let you know when you're to go on to answer question 1, question 2, question 3, etc. And we really do want to get your answers because we're interested in them as well as listening to what our panel members have to say. I hope that's clear to everyone. So if Margaret, do you want to distribute your QR codes, and I will get started. So what we'll do in the panel session, okay, yeah, you work away. Sorry, we're just sorting out the QR code. Yeah.
So if people want to...
It vanished again. There it is.
Yeah, there we go. And it's question 1.
Yes, so we're beginning with question 1. And the focus area of question 1 is on the challenge. And the way the panel is going to work is I'm going to begin and I will ask Simon and Kate a question, and then I will ask Peter and Katarzyna and Aysegul. So, and each time that is the way we will do the questions, so everyone knows what to expect. So, Simon and Kate, if it's okay with you, can you tell us what makes it hard to find out about cancer screening and staying healthy?
I would say there isn't enough easy read for people with intellectual disabilities to actually to understand the process, really. That's what I would probably say.
And we chatted earlier, didn't we, Simon, that people might not know where to find that information. So there might be a lot of information out there, but people just don't know where they are and how to access them and how to find them. So it's either there isn't the right information, or they don't know which one will actually help them in deciding if they want to go to cancer screening or how to even be healthy in their general life.
Yeah.
Or I would say maybe some of the language could be complicated to understand as well. So that could be a key risk as well of why they might not go to screening and things. Yeah.
That's definitely a challenge, and a good challenge to highlight. So thank you very much, Simon and Kate. And Peter, what does the evidence tell us, do you think, about the scale of the problem and the inequalities in cancer prevention?
Can I just say, when I signed up for Cupid, I didn't expect to be sitting on a row of high chairs at the end, waiting to be shut. Anyway,
Sorry, Peter.
but thank you for asking me to. Okay. How big's the challenge? Right, so I've made some notes. So we know that the premise of Cupid is lower life expectancy, higher rates of avoidable deaths in people with intellectual disabilities compared with the general population. And that is partly caused by differentials between them and the general population in cancer. I think there's some evidence, and we are aware of that through Cupid, about prevention, what we can do to prevent cancers, and some about early detection, including screening. I think actually there's much less evidence when we get further along the cancer pathway. I know that's not been part of Cupid, but when we look at the acceptability of treatments, oncology, for example, about the extent to which people with intellectual disabilities are even offered that treatment or surgery, and then further on in terms of palliative care, if required, or end-of-life care. I think we've made real progress around prevention and screening, but some of the further along on the cancer pathways, I think there are really significant challenges which are yet to be met.
Yeah, and Peter, you're so right. I mean, it's great that we're here discussing cancer prevention and screening, but that's only one of the questions, and we need evidence for all those other areas as well. Okay, so Katarzyna, if I may hand over a question to you. So why was this challenge important enough to warrant a project like Cupid, in your opinion?
So I think we really have to respond to all the challenges that people with intellectual disability face, and the challenges that their carers face. I think there are plenty of them, and most of them have been discussed in this meeting. So, in my opinion, one of the biggest challenge that has been discussed here, but also in other projects that I have taken part in, is a lack of coordination and support for individuals with intellectual disability, but also for their carers. We have also said a lot about accessibility here and easy to read, but I have an impression that not enough has been said as long as augmentative and alternative communication is met, because it's not only about delivering information, but it's also about communicating with people with intellectual disability, especially the ones with complex communication needs. What I also think, when we think about accessibility, it's also about the complexity of the healthcare system. So it is also important in projects like that to promote this way of accessibility, to make the health system less complex, but also to support parents, support carers, people with intellectual disability to navigate this system.
Excellent. Thank you so much for that, Katarzyna, and they're really good points that you raise. So, Aysegul, why should addressing these inequalities be a priority internationally, do you think?
Thank you so much. Addressing these inequalities should be an international priority because equitable access to healthcare is fundamental human right, I think. The United Nations Convention on the Rights of Persons with Disabilities recognizes the right of people with disabilities to access healthcare on an equal basis with others. Nevertheless, people with intellectual disabilities, as we know, we talk about during 2 days and throughout the COVID project, remain underrepresented in cancer prevention and screening policies across many countries. An international approach is essential because with any single country, people with ID are too few in number of influence national policy and on their own. Pooling expertise, data, and advocacy across countries gives them a far stronger collective voice. Therefore, international collaboration is essential to share evidence, develop inclusive policies, strengthen research, and promote best practices. During 2 days, we have a lot of international network and very closely, very friendly. I participate in this final conference very happy because I want to explain a bit with my own experience with my sister because of I participated the COVID project for my sister 4 years ago. She had severe intellectual disability person, and why severe intellectual disability causes, I want to explain it briefly. When she was born, she had hypoxia at birth and developed cerebral palsy and epilepsy, and she has severe intellectual disability. And 3 years ago, unfortunately, she passed away when I participated this project, and 1 year later, she passed away. We talk about for her 3 years ago in Ankara, located in Ankara, when Dr. Sebahat Gözüm organized a workshop in Work Group 3 workshop, I remembered, okay. We talk about my sister, and because of I lived my sister for 40 years. When she died, 40 years, and 40 years she doesn't not anything. She completely bedridden person, completely dependent person. Oh, I loved her. I missed her.
Aysegul, I'm so sorry to hear of that loss, and thank you for sharing about your sister with us. Yes. Okay, so obviously Cupid then is really important for people with intellectual disabilities, and there is the challenge of cancer prevention. And I'm going to ask you now to move to question 2.
We just give a bit of feedback on question
Yes,
1 from
please
the
do.
Padlet.
That'd
From
be
the
great.
audience. Laura, I'm going to ask you to do that so we involve our audience as well. Okay, so question, do you want to pick out 1 or 2, Laura, please?
I think
Can I just say we are going to collate all of this and share it with you so that we have a booklet from this panel session.
I think the answers are interesting in terms of they're at the different levels. So some talk about kind of practical things in terms of making information more available, and then people talk about the systems levels in terms of that our systems are not designed, our healthcare systems are not designed for people with intellectual disabilities in mind. So it's interesting to see the different levels in terms of what people are responding at, but I think there's some very important points there that people are making, and people agreeing with some of the points that have been made by our panel. In particular, I think, Peter, you talked about kind of addressing the cancer care journey further along in the pathway, not just getting access and diagnosis, which is very important, and also the need to support carers who are travelling and on that journey with people through their cancer. So that is also very important in terms of that.
Okay, so we can share these, and I know we'll be passing on this share to Vladimir for the website. So all those comments will be available for people. It's beyond the time limit to go through all the comments, but thank you. And we'll go to question 2.
Okay, so thanks everybody. Thanks Laura and thanks Margaret. So the next question area is about the importance of Cupid. So I'm actually interested in finding out from Simon and Kate, why did they want to be part of the Cupid project? And Simon, why you did the webinar with Kate?
So the reason I wanted to be part of this is because about 6 years ago, I got diagnosed with Hodgkin's lymphoma, and I'm a cancer survivor myself, and I have a disability as well. So I wanted to be part of something that will help other people with disabilities understand why it's important to get prevention and things like that. So thank you.
Thanks, Simon.
And just to thank Simon we've worked together for a number of years now, and Simon is so good and eloquently explaining his journey. And you said that on the webinar as well, didn't you? So you really explained like that process that you went through, didn't you? But you're such a conscientious person, Simon. You're so kind, and you that really shines through for I think everyone that's met Simon over the past I feel like you really want people to learn and help themselves know about cancer and screening. And I've worked with Simon, how many years did we work out? 3-4 years coming up now. And I've worked with Camp Hill Village Trust for longer than that, about cancer screening and prevention. And I think it shows that it's a reciprocal process. Like I'm a researcher, I've worked with people with a learning disability as a support worker, but we work together. So Simon's involved in research in Cupid that I've been involved in, but then I'll go to Camp Hill and Botton where Simon lives and do education sessions that really cost me printing costs, like 20p in printing, but really helped people learn about screening and cancer. So I think why I got involved in Cupid is it's my research area and I'm passionate about it, but to share that learning with people who also share that passion and actually want to make real change and not just have words on a page that stand on a bookshelf for years, but have real impact that we can help people have healthier lives.
Thanks, Simon and Kate. And I think both of you together are a real example of co-production in action. So thank you both very much. So, Peter, over to you. So you gave us an indication in your first answer about some of the evidence. But what specific gap in the evidence was Cupid actually setting out to address?
Okay, well, it focused, as we know, on prevention of cancer and early diagnosis or screening for cancer. And there was what we had is a lot of evidence about the poorer outcomes that people with intellectual disabilities experience, but what we didn't know is some of the explanations for that and also what we could do about it. So I think some of the work we've done within Cupid, I think one of the fantastic achievements of Cupid is to bring so many people from so many countries together to see this as a Europe-wide problem. And I think, working as personally within the UK, you can get rather focused on your own health system, your own society, without recognising that actually there are similar problems in other countries where you can work together with people from other countries to find solutions. Sorry, I've digressed now. What's the challenge is, so I think, some of the thing we've done in Cupid is to generate some evidence on the barriers and facilitators, the reasons why people are less likely to take up screening, for example. And we've started I think there are a couple of bids that have come out of Cupid now looking at interventions, how we can improve the situation. And clearly these are early days, but I think that's kind of a strong rationale for Cupid has been the recognition of the importance of this problem.
Yeah. Thanks, Peter, very much. And you're right, it's very much a cross-European project. By working together, as Peter says, we have come up with some, definitely research that will help towards addressing the challenge. Katarzyna, so what motivated the development, in your opinion, of the project?
I have not, in fact, been a part of the project, but being a part of this meeting was a very important experience to me. And I have, because I'm here with my husband, so I told my husband today that I am taking I'm taking a lot of inspirations from Cupid project back to Poland, and I'm also happy that we had some PSONI representatives in the project, even though they come from a different city than I do. I think I do agree with Peter, but also with Martin and Vladimir, who underlined it yesterday, that it's very important to build networks. I am a member of 2 or 3 other networks, and I know how important it is and how valuable it is, how much you can learn from each other, and you can make our voices heard if we work together, if we work internationally. What is also extremely important, what I saw in this project, is its inclusive format. So I could see the perspectives of different groups, the perspective of professionals, not only of the medical staff, but also other professionals, psychologists, educators, etc. We had the perspective of carers, and most of all, we had the perspective of individuals with disability. What I see is, especially when I think about Poland, because I don't know I've learned a lot about other countries here, but my experience comes from Poland, so it is very important to build awareness among people with individual disabilities, their carers, but also among professionals. And I mean all kinds of professionals, all people working with people with intellectual disability. It has also been mentioned here that even if we sometimes observe some symptoms with individuals with neurodevelopmental disabilities, they are often ignored because they are contributed to disability. And they are ignored by carers, professionals, people with intellectual disability as well, and quite often by medical staff as well. So it is very important to raise awareness, but that people with NDDs suffer from the same diseases as the rest of population, and we really have to take care of that.
Excellent. Thanks so much, Katarzyna. And you're right, the importance of a network and the importance of, therefore, the COST support for our network. And we're very grateful to COST for giving us the opportunity to create our network. So we're all very grateful for that. So, Aysegul, why do you think a European and international approach was important?
Yes, I will explain it briefly. International collaboration was essential to success of Cupid for 3 key reasons. First of all, shared learning during 2 days. Partners from different countries brought together diverse expertise, experience, and best practice, helping us better understand and address inequalities in cancer prevention. And the second one, transformable resources. We listened in the morning and in the afternoon, good transferable resources. Working international enable us to develop tools and resources that can be adapted across different languages, cultures, and healthcare systems. Easy-read materials we listened from England. They are very best practices for these people. And AAC materials also best practices for these people, and stronger advocates. These people are vulnerable people, like I am a pediatric nurse, like newborn, because they couldn't advocate your rights. So these people, intellectual disability, people, children or adults, it doesn't matter, they stronger advocacy by bringing together researchers, healthcare professionals, self-advocates, and family carers. CUPID created a stronger collective voice to influence policy and promote more inclusive cancer prevention services. I would like to thank you to bring us together. With my pleasure, Professor John Wells.
Thank you so much, Aysegul. And those are three really good reasons which capture why the European and international approach is important. So now we go back to the Padlet and to your views.
Yeah, so it's very brief. I think a synopsis would say accessibility, data availability, and I love the one where somebody said popularizing cancer prevention. So that's it. And the reason we have two, because it was the reason we have two Cupid there. Why is Cupid important? We thought people would continue writing and writing, so we put two. Okay. Sorry.
Thanks, Margaret, very much for that. So moving on to the next question area, which is like the view of the panel members and yourselves about the strengths of Cupid. So, Kate and Simon, has being involved in the project helped, do you think, in any way? And Simon, maybe have you learnt anything new, or if yes, could you explain?
I would say I have learnt some things that are new, so I'm trying to think of one, sorry. I would say doing the easy read thing, so making things like easier for people with intellectual disabilities understanding and things. And then I'm trying to think what else.
You went to Martin and Kayla and Vladimir's talk about statistics.
Yeah, I went to the statistics thing as well, which was really informative, which was good.
Yeah, you said. So, Simon, we did the first Lunch and Learn session about what is cancer and what is screening and what is prevention. And then I shared with Simon the rest of the Lunch and Learn series, and he was straight away wanted to know more about the statistics and how many people with an intellectual disability, get cancer in that profile. And you joined that webinar, didn't you? And kind of messaged me after, kind of saying it was really interesting and you learnt lots of things. But we were reflecting in the break that how much Simon has learned over the past few years since being involved in Cupid, but also in being involved in research more broadly. So at the beginning of when we first met, you'd done very little research. You'd kind of been involved a lot with Camp Hill and doing the life reviews, but being involved in the design of research, you hadn't really done. When now, you'd said today that you were able to understand some of our presentations, even when they weren't in an accessible format. So yeah, I feel like you've learned a lot more than you give yourself credit for. What else was the question?
No,
Sorry.
that's it.
Okay.
Kate, well done. And that was great to hear that Simon has learned so much and benefited. I'm sure there's others also who have benefited, including myself, so thank you for that. Peter, in relation to what we have produced, what was particularly innovative or important from a research perspective, do you think?
I think, I think some of the most important research outputs are yet to come. I think the policy review, I was talking to Susan, who was here from this morning from European Cancer Network. No, is it Susan or Sarah? Sorry.
Sarah.
Sarah, apologies.
Yes, Sarah Collin.
We were talking about doing systematic reviews in policy research, and how unusual that is, actually. You don't see, most systematic reviews you see in our area are to do with healthcare interventions, prevalence rates and so on, but reviewing in a systematic policy work, I think is still very innovative, and I think that review will make a real contribution once it's published. A review of reviews has been a labour, hasn't it? Oh, you've taken most of it, but that actually still is, the idea is that will provide higher level evidence. And that's one of the reasons why it's so difficult to do, I think, is because actually you're reaching really high actually to try and to develop a new level of evidence. So I think those two outputs, there are many others, but those two outputs I think are yet to come. I think one of the as I said in my answer to my previous question, one of the main benefits is to bring people from different countries, different health systems, different cultures. I was having a really interesting conversation with Bilge yesterday about HPV vaccination. If you don't mind me saying about, about the acceptability of delivering HPV vaccinations to boys and how much that varies across countries. Of course, it varies across the European countries and parental influences, and something, you can take for granted the kind of cultural assumptions you have in your own country. And one of the benefits of Cupid is being exposed to different cultural influences. I think that's such an important finding.
No, I agree, Peter. And yes, I really do want to thank all of those involved in both of those future publications. They're really strong publications from Working Group 2 and Working Group 3, and we really look forward to reading them, and we appreciate the amount of work you've done on them. So, Peter, thank you for drawing attention to those. So, Katarzyna, I know you haven't been involved in the project for long, but maybe that's good because you might give an outsider perspective. But what project achievement do you think we should be most proud of?
Yes, so from the outside perspective, I think that building the network is a huge achievement, of course. But what is also much more important, what is even more important, is that this project has been carried out in a partnership mode, in a partnership format, and I think we should take it to our countries, because we really need transdisciplinary teams. We need teams consisting of professionals and non-professionals working together to support people with intellectual disability, and we need multidisciplinary teams. So we can't work separately if we want to support people with intellectual disability. I also think that the things that you have presented today, the workshops and the accessible materials to train individuals with NDDs on how to prevent cancer or how to recognize symptoms, we will be able to take them home, to take them to our countries, and disseminate them in our countries, and thanks to that raise awareness among individuals, but also carers and professionals. So I'm really impressed with what has been done here in this project.
Excellent, Katarzyna, and I'm delighted that you see, because we're very proud of some of the resources and the work that has gone in, and it's great to think that they will be used by others outside of the action, which really brings me to Aysegul and your question, which is, what impact do you think Cupid has had beyond the project partnership, or do you think it could have beyond the project? Yes. Oh, Villa, I'm happy to come back if you like.
What impact in my way, it's more important achievement has been raising international awareness of the inequalities that people with intellectual disabilities face in accessing cancer prevention and screening services. Cupid also created strong and lasting international collaboration. The network established through the project continue to support new academic and social partnership, I think. It's also provided valuable opportunities for early career researchers to gain international experience and build new expertise. We listened today, newly career researchers, some experience in the Cupid project.
Yes, thank you so much for that. And it's great to hear. So I'm going to hand over to, do you want to look at the answers? Laura? Yeah. For question 3, is there any answer you want to draw attention to? We'll do, okay, so I'm going to move on now to question 4. There's no break for the panel members this time. So Simon and Kate, what do you think would make it easier for people with intellectual disabilities to get cancer checks, to have screening and reduce the risk of cancer? What would make it easier?
What would make it easier? Trying to think, actually. So probably making them obviously, so maybe doing some of the self-check things and stuff. So that presentation earlier on was really useful from, what was it? From Olivia.
Yeah.
We chatted about talking
Yeah. So I was going to say maybe talking about it a bit more as well. So rather than hiding it away, just actually say, look, this is what you've got. Then it might be easier, because I feel like it's sometimes a bit like covered a bit.
Yeah. No, you're right, Simon. That's exactly it. Kate?
Yeah. And we said, didn't we, Simon, that comes from a place of protection. Like, people want to not make people scared and not make people upset. But we when we were talking, we were saying that can be bad sometimes, because...
Like, if you're covering it up, then it's almost like you're hiding something. And it's like for me personally, I would rather know what's wrong rather than having something covered up and then not being something that you can prevent.
Yeah. No, that's a really good point. That the Cupid project brought things out into the open and maybe stopped it being so covered up or so hidden.
Absolutely, and making people aware of what cancer is and how you can prevent it. So when we did some workshops, didn't we, some of your friends were a bit scared of what we were talking about and kind of apprehensive, but by the end of the session, you know, they were reading the Easy Read booklets, they were talking about it to people who hadn't attended the workshop. So just by having an open and honest conversation that people can understand, you know, really helped people then take that learning. And, you know, we were chatting that people were using the Easy Read booklets for weeks after showing their friends and across the community. So, you know, just...
I do think it's a bit of a taboo subject as well. So that's why I do sometimes feel like maybe that's why it's like sort of like you don't really... like some people might not find out about it, really.
Yeah, no, you're right. So it's good that we're not having a taboo anymore. So thank you for drawing attention to that, Simon and Kate. So Peter, so the biggest gaps, what should research kind of focus on, do you think?
I think, well, there's still a lack of evidence, and I think I've given that in my answer already. Mm-hmm. I think some of the responsibility rests with health systems and health services, and you know, there are most countries hard-pressed practitioners working within very busy systems. Mm-hmm. So, you know, you're loading more into them. But I'll give you an example from the UK. In general practice, if your family doctor, they're incentivized financially to have a register of people with learning disabilities who are registered at their practice. Yeah, they're given a financial incentive to do that. So, no surprise, actually, the number of people who are on the register now is gone up, and the registers are there. It's very good. It's a really useful resource. But when you get an invitation to take part in bowel cancer screening, that's national. You know, a letter is generated nationally. It will come out to you every 5 years, I think, from the age of 50 now onwards in the UK. But there's no integration of those. So the letter arrives from a national system. There's no adaptation of that letter according to your learning disability status, because they don't have access to that information that's held locally. So something about the lack of integration between two different parts of the health system is not enabling the best use of that screening program, just as an example. So some evidence around how we can improve that, I think, is really important. And that would apply in other screening programs too.
Absolutely, Peter, and certainly there are systemic barriers that we do need to get addressed. So, Katarzyna, so in terms of what type of improvements do you think are needed in resources or education or implementation to kind of address those barriers?
Mm-hmm. A lot has been said about easy to read. There is just one thing that I would like to mention. That it is very important that easy-to-read materials are developmentally appropriate. So it really matters if we prepare it for children or for adults. It is also about the standards of easy-to-read, because each language, most European languages have their standards for easy-to-read. There is the Inclusion Europe standard for English language, for example, and this is also something that we should, I think, decide on if we will use this standard or because these materials look different, okay? It really depends on who was working on it. And it is important for people with neurodevelopmental disabilities that when it is easy to read, it is always the same. We also need a logo. Inclusion Europe has a logo. So it is then easy to find the material that is easy to read. You don't have to, search through a lot of materials, but you see the logo. Okay, that's what I'm looking for. What I also think is important, because we had a wonderful speech of Daniela this morning. So I would really love to see more self-advocates and more inclusion, not only as people who are trained, but also people who train us. Because this is what Daniela has done this morning. She has trained us on how to support people with intellectual disability. She pointed out things that they need when they are in a hospital or suffer from any kind of disease. So these are the most important thing, and a big challenge is now something that often happens with projects like this, how to reach people with intellectual disability, carers and professionals, and disseminate all these things, wonderful things that we have worked out in this project.
Thanks so much for that, Katarzyna. And I do agree, we can learn an awful lot from those lived experience from Daniela this morning, Simon this afternoon, Justine and Alicia and Valerie. It's wonderful to be able to learn from all of them, absolutely. So, Aysegul, over to you. So what policy or system level changes do you think are needed to drive long-term improvements in cancer prevention?
Yes, although COVID achieved important progress and significant challenges remain, first of all, policy commitment. The evidence generated by COVID should be translated into national and international health policies. Every country, we have some national policies, cancer prevention or early detection, but these people with intellectual disabilities are invisible in these policies. We certainly visible these people in the policies. And people with intellectual disabilities should be explicitly included in cancer prevention, screening, and cancer strategies. For example, national cancer plans should require accessible communication. We talk about communication difficulties are very important problem. These people, reasonable adjustments, and targeted outreach for people with intellectual disabilities. And the other one, funding. While COVID has established a significant network for research, education, and the other healthcare professionals, for example, dedicated funding should support for the national implementation of the easy-read materials, training modules, and awareness tools developed within the project. And the last one, workforce development is essential. Education and training of healthcare professionals are also essential. I lived this experience for 40 years. I am a nurse because unfortunately healthcare professionals do not be human. These people are, I said, invisible and second person, unfortunately, in the healthcare system. But these people are very special people, and their parents also special. Topics such as intellectual disability, inclusive communication, person-centered care, and health equity should be embedded within medical, nursing, and allied health.
No, they're all really important points, and the policies, I think that systematic review of policy is going to be so important, and I think your points about the workforce, it's essential that we reach out into the workforce, which is why the evaluation protocol developed by Working Group 1 can be really valuable, because that is targeted at the workforce. So Aysegul, thank you for bringing that to our attention. So, Simon, back to you, but we're nearly there. So, I'm going to actually skip to the final question. Do you want to do 3 and 4 before I go?
No,
They're going to do it at the end. Okay, they're going to whet your appetite and leave you waiting to see what you all said. So, I'm going to go to the final question, which is, what is the one thing, Simon, do you think that people should know about cancer screening prevention and people with intellectual disability? What's the one thing you think they should know?
I would say the one thing that you should know about it is it's there to protect you, because it might not necessarily be cancer, but it's there to make sure that you don't have cancer. So that's why I would say it's worth going to. So you don't be afraid of going for it just because it says cancer on it. I would just say get it screened out, because otherwise it's like if it was cancer, then you didn't go, then there's serious consequences in that. But if you go and then it's not cancer, then it's like, well, I'm kind of glad I went for the screening, because it can work both ways, really, because I would say, really.
Yeah, I agree. Good points. Kate, do you want to add anything?
Nothing else to add.
That
I feel
is
like
a
that's
perfect
strong
message.
enough.
Yes, get screened, I think, was the message Simon was saying. So thanks, Simon. Peter, a key message from the evidence, if you were to pick out a key message.
I'm not sure about the evidence.
Okay, key message then.
Okay, screening and prevention of intellectual disabilities, it's really important, and it's possible. There's two reasons, aren't there? Yeah. But yeah, it's possible, and sometimes it needs adjustments, but it's achievable.
Yes, thanks so much, Peter. And Katarzyna, for you, what would be the key message?
I have three. The ones that I'm taking home message, maybe. Yeah. So the first one is communication may save life. Because I'm very much into the field of communication, so I take it home that communication may save lives. Yeah. Another thing is that the outcomes of this project do not refer just to cancer prevention. Yeah. It refers generally to the healthcare system and its accessibility. And I have forgotten the third one, so I have saved some time.
They were good, strong messages, Katarzyna. And Aysegul, a key message, do you think?
My key message, access to cancer prevention and early detection for people with intellectual disabilities is not a privilege, but a fundamental human right. And the second one, inclusion is essential, not optional.
That's a good way of putting it. Thank you so much for that.
Oh, I remember the third one. Sorry.
Oh, good. Katarzyna.
Yeah, being able to navigate the healthcare system is a part of independent living, because we talk a lot about independent living, and this is also a very important part of it.
Excellent. So we had two other questions on the Padlet, which we had hoped that people would look at, and they probably have looked at. One was, as Cuba comes to an end, what should happen next? So that's what we would like you to look at.
Laura. So I think a lot of these comments, some of them have resonated with what the panel has mentioned about, interestingly, encouraging centres and foundations to get involved in promoting prevention, which I think is a really good idea. Improving the cancer education model for intellectual disability people, given their formal and informal caregivers. New application or network building platform that is constantly evolving, Cupid 2. So, evaluation of services using the evaluation protocol longitudinally, like what Suzanne had spoke to. Also about the importance of practical and applied interventions, that the publications are important, but also the practical interventions and practical takeaways that have been mentioned by the panel are also very important. And that we have a group of interested members that we should continue to keep a hybrid type of Cupid network going.
What could I say, Laura? I mean, you've done it so well. I have nothing more to add.
Well, it's really everyone's comments, but does in terms of the closing question, I think this is a really good point. Someone asked in terms of if the audience remembers one thing from today, what would it like it to be? And they said just two things. They said about how hard it is to say things in an easy, understandable way, which I think is very true. And also that prevention is the recipe for a long life.
Oh, yes, that's super. Thanks, Laura. Great. Thanks.
So I just want to really thank our panel members. It's not easy to be put sitting, as Peter said, sitting on a stool in front of all of you at a height, so there was a really good view. But I really am appreciative of Simon and Kate and Peter and Katarzyna and Aysegul for sharing their expertise with us, and we're really glad that you did it, so thank you.